Welcome everybody to our workshop for the South African Mental Health Innovation Network. I'm Katie McNeil and I'm going to be your host for today's session. He's been talking this morning, but I'll introduce everybody to Dan Gordon, the board chair of Colleaga. Dan, do you want to say hello?
Good morning, everybody again.
And on our call today, we also have George Watt, who's one of our distinguished faculty members. He'll be helping us out later on in the session with our breakout rooms. I'll also draw everyone's attention to our fabulous innovation Sherpas. They're who you can reach out to in the chat throughout the call today with any questions, be that technical or administrative. So I'm sure at this point we're all Zoom aficionados, but I would like to go over a few ground rules just for our session today. So it is an interactive session. We do want you to be interactive and connecting. It's really core to the Colleaga community. So please do leave your videos on throughout the entire session. We do ask you to leave yourself on mute when you're not speaking, and that's just to reduce any background noise. I also mentioned the chat function earlier. I'll just draw your attention to it once again. It's just at the bottom of your screen. I think Michiko just introduced herself in the chat. So Michiko is also someone you can reach out to with any questions that you have throughout the session. This is being recorded. So if anyone wants a recording of this afterwards, just let us know. We will be releasing footage of it though in our community following the session today. So we're looking at about a 2-hour session today, which has one key objective, establish a common vision of what the South African Mental Health Innovation Network is, and introduce you to some of the people on this call who could be a part of it. So in the beginning of this workshop, we'll explain why Colleaga is involved in the creation of this network and what its broader purpose is. And then in the latter half of the call, we'll be going through some design thinking exercises to really give you a chance to give us some feedback and to get some of your expert feedback on this network that we're creating. So with that being said, I'll hand it off to Dan Gordon now to introduce you to Colleaga and what our collaborative approach is. So over to you, Dan.
Thank you, Katie. And really, it's an absolutely real pleasure to be seeing so many familiar faces and new faces with us today. It's really fabulous. So thank you, everybody, for making the time. I know that we're all completely zoomed out and there are millions of demands on our time. So we super appreciate you joining us today. About 10 years ago, a small group of us started a conversation with the three main payors and three main hospital groups in the private healthcare system in South Africa, representing about 10 million covered lives. And that conversation was about how do we build a consortium among fierce competitors, but also organizations that have common goals. The conversation was about how do we share data that each of us is collecting so that we can improve care for our members and for all South Africans. That conversation went on for a couple of years. There were definitely ups, there were downs. Our good friend in South Africa, Lance Malherbe, joined that conversation a few years in. He became Colleaga Distinguished Faculty. Today, that conversation resulted in Care Connect, which is a health data exchange set up to share data across the healthcare system in a secure and confidential way, but to improve care for members of the private healthcare system and for all South Africans. That was the genesis of Colleaga. It was this idea that we can build networks of cooperative mission-based innovation programs and venture studios. And we can bring together public, academic, and industrial innovators to collaborate on difficult, complex social problems. Our members are the health and social system professionals who are working on the front lines to improve wicked challenges, like Deborah Jadakin, another of the Colleaga's distinguished faculty. They're the inventors and the creative experts who have ideas and products, like our colleagues from NextJ Health who are on the line today, and other innovators who will be joining us. They are the entrepreneurs who can collectively see past the status quo to the possibilities of how we can invent new futures. And they're the investors who are doing old things, but in fundamentally new and different ways. Today, we're also delighted to bring Colleaga Capital, our newly launched impact fund, to our community as another vital tool for innovators on their path towards commercialization and sustainable financial success. So Colleaga has three main amplifying engines. The Colleaga Impact Financing Engine is a syndicated multi-stage global impact fund. It includes blended finance from public finances, from impact investors, from angels. And the idea is to deploy capital to support innovators across multiple stages of growth. And I'm delighted that our colleagues from Kingston Capital, who are doing exactly this, have joined us today. The Colleaga Community Engine is a network of open innovation impact accelerators. It is our mentors, our experiential learning programs, our startup communities, all of us who have a shared belief that it's through generous collaboration on sustainable development, we will be personally and individually successful. And it's our Impact Collaboratory, which is our resource pool. It's our social platform for hosting living in laboratories, partner products, innovation infrastructure, data sources, and different kinds of commercialization and public-private value creation tools designed to support impact ventures, focusing on the problems that they are passionate to solve. And what impact ventures are this combination, they're consortiums, combinations of professionals working on the front line, inventors with products, people from different groups who are interested in the solution, getting together to say together, we can figure out how to make progress against the goal. Because the fundamental issue with delivering impact with these complex social problems is that you have to do it together with others. So our approach is very simple. What we do is, and you are involved in this today, we get together people to ignite change. We bring together partners in public, private, and nonprofit sectors, and we say, let's try something new. We then get into a design phase where we say, how are we going to do it? And let's develop new tools. Let's develop an approach that we think can create great impact. We are then completely into experimentation, where we are going out and we are actively learning what is working and what isn't working, what experiences work on the ground and what don't. And we adjust our methodologies as we do that. We then need to prove, and it's all about the data, measuring, monitoring our performance, and seeing how we need to change. And then when we discover what works, then we scale, and we collaborate those who can best scale with us. And it's an iterative process where we keep on going around these loops to get better and better at what we do. So Colleaga is about experiential learning right from the start, and we're going to start that right now. We will start actively learning, and we will connect using our health and social innovation community platform to begin starting to introduce everybody who is on the line to each other. Katie, over to you.
So thank you, Dan. Our health and social innovation community is a space that brings together innovation consumers and solvers to create an innovation ecosystem where we can learn from one another by sharing our knowledge and resources to ultimately make progress on complex challenges more quickly. So we will be using this as a tool, like Dan said, throughout our session today. And we have made accounts for most of you on this call. I think we might have missed one or two late joiners. Let's take a moment now to log into our accounts. So like I said, we have created these accounts for you. If you don't think you will be using them after the call today, you can always delete it. You can do that by deleting it yourself in the network, or you can send me a message and I can delete it for you. But we do ask that if you're not finding what you're looking for in this community, please do let us know, because it is an experiment in community building, and we do want to try and respond to our community's needs as best we can. So we're always open to hearing feedback about it. So let's take a quick moment now to log into our accounts. Michiko shared a link to the community in the chat. Please click on it to head on over. So for those of you who already had accounts prior to registering for this workshop today, please log in with your usual credentials. But for those of you who just had an account created for you for this workshop, you'll need to sign in with the email that you used to register for this workshop with. And then you'll have to use a temporary password that we've provided you. The temporary password is up on the screen, and I think Michiko shared it in the chat. If you're unable to log in, or if we weren't able to make an account for you, I will be going through the community and the activities on the screen, so you can follow along with me. And then for any interactive bits, you can post things in the Zoom chat if you like. And I'll also mention, if you do have trouble logging in or you do have questions, please reach out to Michiko or one of the Sherpas. So like I said, I will be going through this activity as well. So if you would like, what you can do is you can split your screens so that on the left-hand side, you have our Zoom call. And then on the right-hand side, you have the web page, your browser open. So that way you can follow alongside me. If you're still logging in, I'll give you a quick second just to check back in on my on the Zoom call here, just to see how that might look. And I'm going to go ahead and get logged on now myself. So again, any questions, please reach out. Okay, so I'm going to go ahead and get started. So welcome, this is the Health and Social Innovation Community. So this is a space where you can come to find articles that we're sharing. We'll sometimes share challenges that are going on, funding opportunities. You also have access to all of our members here. So our faculty of experts, along with the community of innovators that we have, who could all be potential resources to you. And we also post in this community about upcoming events that we'll be hosting. So you can always come here to check out what we've got going on. So to get started, I'm going to ask you to look at the left side of your screen. There should be an open menu bar. If there's not already, you might have to click on the 3 lines at the top left corner just to open that up. And then I'll ask you to go down to the circles tab. Click on that to open it up. And on the first circle, you'll see the South African Mental Health Innovation Network. For some of you, you might have a join here button. Please go ahead and click on that. If you don't have a join here button and you just see the group, just go ahead and click on it to open it up. So this is the circle for the Mental Health Innovation Network. You can kind of think of it as a hub for the network itself. It's a space where you can come to find all the relevant information that is pertinent to the network. Like the network itself, it's still in its infancy, so we're still building it up and putting in information. It's still at its kind of beginning, but it's where you can come throughout. If you have questions, if you have ideas, you can always come to this network to post anything you might be curious about. So to get started, what I would love to do is have you introduce yourself into the community. So if you're comfortable, I'll give you a quick moment now to write a post, just introducing yourself. So let us know where you're from, what you do, and what you hope to get out of this network. If you don't have an account yet, you can post just right into the Zoom chat, and then our Sherpas will copy and paste directly into the community. If you're not comfortable making a post quite yet, that's totally fine. Essentially, what I'm going to do is I'll give you a minute now to write. And then for those who do make a post, I'll ask you to introduce yourself, and then I'll open it up to everyone on the call today, and we'll quickly go through and introduce ourselves. So with that said, I'll give you a moment now to write a quick post, and then we'll go through some introductions. Okay, so I'll start off with some of the introductions. George, I see you here first. Do you want to say hi to the group?
Hi, everybody. I'm George Watt. I'm the author of a couple books on innovation, including my latest, which is Lean Entrepreneurship, Innovation in the Modern Enterprise. And currently I'm here in Ottawa, Canada, where I'm a partner for responsible for strategy and innovation with a company called Becker Carroll. We help public and private sector organizations to solve difficult problems and to turn good ideas into great, vibrant programs or offerings.
Thank you, George. Ashkan, I see your post here. Do you want to go ahead and introduce yourself?
Sure. Thank you. Hi, everyone. So I'm Ashkan Rotman. I'm the Director of Solution Delivery at NextJ Health. And my team and I are responsible for leading successful implementation and deployment of projects for clients. So we are the client-facing team of the company, sitting with them from requirement gathering to design and configuration, implementation, training, support after go live.
Awesome. Great to meet you. And we will have more opportunities later on in this call as well to meet everybody, but this is a great first introduction. So Wesley, would you like to say hi to the group?
Hey guys, my name is Wesley Douglas. I'm a former senator in the South African Parliament. I serve on the Black Business Council executive. I do a lot of work for government, both in the health, safety and security, other sectors. I'm a senior research fellow at the University of Guangdong. And yeah, I've also authored a couple of books, and I'm a public speaker and do a lot of foreign direct investment programs, twinning agreements between municipalities within the BRICS Council environment. And yeah, that's a little bit about me. Thank you.
Awesome. Nice to meet you, Wesley. Jay, I see you wrote a comment here.
Good morning, good afternoon, good evening, everyone. I'm not sure what time zones you're in. My name is Jay Lynch, and I'm a registered nurse and privacy professional practicing in Ottawa, same place as George. Was snowing here a little bit, but that's dissipated, thankfully. During my career, I've been involved in telemedicine, clinical telemedicine, and EHR, EMR implementations. So that's what brought me here today. So I'm looking forward to learning from all of you.
Awesome. Nice to meet you, Jay. I'll open it up now. I'll just go through the list quickly. Casey, did you want to do a quick introduction?
Great, thank you. Good afternoon from South Africa. My name is Cassie Chambers. I'm the Operations Director at the South African Depression and Anxiety Group. We normally deal with patients and stakeholders on the ground and provide support services and crisis intervention. I'm really looking forward to engaging and learning through this platform. So thanks for including us. Thank you.
Nice to meet you, Casey. Jane, did you want to go ahead?
I'm Jane Ball, Head of Population Health Management at Discovery Health. And my passion is behavioral science, so embedding that into the solutions, and I'm based in Cape Town in South Africa.
Awesome. Nice to meet you, Jane. Welcome. Willie, I see your comment here. Oh, maybe Willie stepped away. I'll come back to you, Willie.
No.
Oh, you're here?
I just need to unmute myself.
No problem. A classic Zoom foible.
So that's the old problem when you're used to Microsoft Teams that keeps on telling you with big signs that you've muted yourself, and Zoom doesn't do that.
I know.
That probably will do. So yeah, my name is Billy Appel. As I stated up there, I'm the owner of a lovely small company called Digital Minds, and we focus, we actually do call ourselves data and digital Sherpas, and focus specifically on exactly what Dan was talking about, how to make data being central and first and foremost in every executive's mind and how they drive their organization. I'm a South African that lives in the Netherlands. And, you know, as Lance, a good friend of mine, actually knows, I've told him probably a couple of hours ago to say I've just gone from 50 shades of sunshine being in South Africa to 50 shades of gray being in the Netherlands. So that's me.
Awesome. Nice to meet you, Willie. Deborah, did you want to introduce yourself?
Good morning. My name is Deborah Jadakin, and I am a licensed psychotherapist. I am from Zimbabwe. schooled in South Africa, and now living and working in San Diego for the last 20 years. So I've been engaged in telehealth, telecounseling for the last 10 months and a little bit before that. And I'm really interested in looking at solutions for something workable post-pandemic that reaches as many people as possible in terms of psychotherapy and trauma counseling.
Awesome. Nice to meet you, Deborah. Welcome. I'm sorry if I mispronounced this name. I see one in our Zoom chat here. Is it Amar?
Yes, hi, this is Amr. Yes, I'm talking. Sorry, I joined late. Just Dr. Osama Hassan reminded me about the meeting. I'm currently driving, but not driving, but in the car. So my name is Amr Jamal. I'm a family physician and clinical informatician. I'm associate professor of the family medicine and clinical informatics, chairman of the family medicine department in King Saud University, Riyadh in Saudi Arabia. So I'm from academic and research perspective. I have several articles related to the mental illness. So I mainly using social media for the mental consultations and also the telepsychiatry also. So this is my interest group or subjects. Thank you so much.
Awesome. Nice to meet you. So I'm going to start going through the list here quickly. And David, did you want to introduce yourself?
Yeah, hi everybody. So I'm David Khan. I'm founder and principal of DBK Future Strategies. I'm located in Israel, so you can see the afternoon sun streaming through my windows. I've had to put the shutters down. I'm a corporate financial advisor, and I'm focused on helping entrepreneurs, particularly in the technology sector, and within that, particularly in the healthcare and software sectors, who are looking to raise capital to fund their innovations and fund their companies going forward. Awesome.
Great. Nice to meet you. I see we also have Errol on the line. Did you want to make a quick introduction to the group?
Hi, I'm Errol Singer, originally from Cape Town, but now in Toronto. Thanks for including us. I'm with NextJ Health. I'm the CFO, and you've already met Ashkan. And we provide a cloud-based solution for patient-centered health and wellness, focused on chronic conditions and including mental health. And we have a solution that is currently being used in a pilot with the Canadian military. We've also worked with on the research side, and we've actually got, a study coming out very soon about how behavioral change and wellness can help in reducing depression. So great to be here. I look forward to participating.
Great, nice to meet you. And I think we just have a few more to get through. So Kerman, would you like to introduce yourself?
Yeah, so my name's Kerman. I'm from Johannesburg, South Africa. I run my own tech company. So we focus on software development. So currently I focus also on disrupting and innovating, obviously in different industries. And yeah, that's pretty much a bit about me. And I like networking, igniting new ideas, and obviously creating relationships that materialize. Yeah, so thanks for having me.
Fantastic, thanks for being here. Osama, would you like to make an introduction to the group?
Hello, everyone. My name is Osama Hassan. I'm from Dubai. Actually, I'm wearing multiple hats. So initially, I work for the regulator of healthcare in Dubai, United Arab Emirates, which is Dubai Health Authority, which is a healthcare provider, and it's at the same time the regulator for the entire private sector there. Also board member of the International Society of Telehealth and eHealth. So I have a special interest in telehealth solutions. I'm also very interested in innovation, in digital healthcare innovation in general. So thank you.
Awesome, nice to meet you, Osama. Ross, have you made an introduction yet? Would you like to introduce yourself?
Thanks, Katie. So Ross Genvy, I'm a general partner at Kingston Capital Partners, which is a VC fund based in Durban in South Africa. Yeah, we invest in the health tech space and in various other innovative startups. And we are in the process of raising a $100 million fund for Fund 2, which we are looking at building or bridging the gap between, say, South Africa and some African startups and the US market. So that is our play. Always good to network, always good to find out what innovation is happening out there and what opportunities there are to invest in the space.
Awesome. Thanks for joining. Stephen, did you want to go ahead and introduce yourself to the group? Stephen's stepped away. We'll quickly move on to Tony. Did you want to make a quick introduction?
Hi guys.
There we go.
Hi guys. So I'm from South Africa. My focus mainly is in disruptive tech, especially around the business models around that. And from a healthcare perspective, my focus would be mostly in the township space. How do we bring the service to the township space? That would be the focus that I would be looking at from a tech perspective. Thanks, guys.
Awesome. Welcome. And then we have Veronica. Veronica, would you like to say hi to the group?
Yes, thank you, Katie. So my name is Veronica Litinsky. I lead the team of geneticists, IT people, and data scientists at Genuine. Genuine is a personalized medicine company. Using genetics, we've developed a software and a service capable of making medicine safer and more effective. And specifically, we actually just this year completed a trial in mental health. And my interest is in delivery of scalable solution using our software, but also specifically in mental health, how to sequence interventions most appropriately. So we achieve best health outcomes and also efficient utilization of healthcare resources at scale.
Perfect. And then I think we have last but not least, Lance. Do you want to say hi to the group?
Hi, Katie. Yes, thank you very much. And Dan, I am so thrilled. We've got 26 people on this call from all over the world. And who would have imagined this? As Dan has mentioned to you folks, we met during 2018 with the Care Connect Health Information Exchange project. At that stage, I was still assigned to Gartner. And I really like the method that Colleaga applied in innovating. And we, I think we also during the procurement work stream that I led used competitive dialogue processes where competitors actually started innovating and building the solution for the customer. It was quite a novel and new way of thinking about delivering projects with big social impact. So that was a success story. And when Dan reached out to me, Dan, I think it was around August this year, we started looking at how we could do something in South Africa. And that then led to a call in September, and here we are. And I just need to acknowledge, Dan, your team's incredible support for getting this initiative off the ground. I'm based out here in Pretoria, sunny South Africa, and will be the Colleaga body on the ground. So happy to meet up with many of you, hopefully in person, as we move forward with this initiative. Thanks, Katie.
No, thank you guys. It was great to meet you all. So exciting to have so many different types of people on the line today. And just to show you that this is how you can use this community to connect. So you can always come back here, make a comment, start a dialogue with someone. It's really the beginning of the collaborative process, and will be available to you as long as you need it. So with that being said, I will pass it back to Dan now to give a little more information about what this network is.
Thank you, Katie. And let me echo our good friend Lance's words. It's just fantastic that we've got such an international and varied group with us today. So why did we all join? Why are we taking the time to do this? And why do we need a South African mental health innovation network, and why now? I think the answer is that it's a combination of need, opportunity, and commitment. I think many of us on the call today are very familiar with the data, but just some data points for us all. According to the National Alliance of Mental Illness, 1 in 5 Americans, Canadians, and I will extrapolate without data to Africans, will experience some type of mental illness each year. And 10%, it will be serious illness that significantly interferes with one or more life activities. And that includes schizophrenia, bipolar disorders, and other significant mental health conditions. At the same time, the countless others, the numbers range from 15% to 35% of people live with addiction, depression, and anxiety disorders. And it's not just the people who live with these disorders that are impacted, it's our society as a whole. Serious mental illness costs hundreds of billions of dollars in lost earnings every year through presenteeism and absenteeism. And not just for the individual concerned, but for their carers who can't get to work because they need to care for somebody else who has disease. Mood disorders like depression and bipolar disorder are the 3rd most common reason for hospitalization of patients between the ages of 18 and 44. All of us who are involved in delivery of care in hospitals or in financing care in hospitals are directly incented to try and reduce the number of people who are coming into our emergency departments with these conditions. And overall, adults who live with mental illness die an average of 25 years sooner than others. And that's largely due to their inability to cope with what are treatable conditions. It's old people living with isolation and loneliness, but it's also young people, students who suffer from mental illness, drop out of high school, and the entire life career is changed. And most tragic, 90% of children who die by their own hand of suicide suffer from a mental health condition that could be treated. There are terrible societal costs. And COVID-19 has taken what was already this major issue and has amplified it and made it exponentially more serious with a triple pandemic threat of this invisible, omnipotent threat of infection, profound disturbances in our daily lives, and massive economic disruption and uncertainty. That combination, Kaiser Foundation and other studies are showing, have doubled the number of people who are reporting worsening mental health conditions, 3-fold increases in depression, anxiety across the board everywhere, but disproportionately affecting people with fewer resources. The need for an order of magnitude increase in access to care is real, and it's now. But out of this adversity and necessity has come opportunity. On the somewhat brighter side, over the past few months, as COVID-19 has near shut down global health systems, we've seen that data-enabled health tech, and particularly virtual care, has gone mainstream at scale. By one estimate, telemedicine claims have risen by 4,000% in North America. There's another statistic that says 69% of all outpatient visits were done by telemedicine in the United States at the peak of the COVID threat in the first wave in April. And that's going to be a repeated experience coming up for North America in our cold season in January and February. It's led to massive investments in on-demand healthcare services. And that category includes the companies that are offering traditional one-on-one patient-provided telemedicine interactions and the technologies that enable synchronous and asynchronous delivery of healthcare from remote clinicians delivering care to patients. It was the top funded investment proposition in the last quarter. And that included telemedicine services and new non-traditional business models like prescription delivery and services delivered through pharmacies and at-home urgent care. And it's delivered by those companies who have integrated telemedicine touch points into a continuous remote care organization. They've incorporated sophisticated analytics for population-based understanding. They do demand prediction, scheduling optimization, and they have billing interoperability. Those companies, consumer adoption, and $2 billion worth of investor dollars across 48 deals are signaling to us that there's a shift towards business models that are achieving specific population outcomes and greater efficiency through better access to this mix of self-care options, virtual touch points, group care, and one-on-one care across a continuum. And it is typically for specific chronic diseases and for mental health and behavioral health conditions. The second category of incredible investment is because these lockdown lifestyles have increased demand for companies involved in mental and physical wellness, general health maintenance, and promotion of fitness, nutrition, and sleep. All of us have heard of Peloton. Zwift raised $450 million. Across this category of 21 deals in the second quarter, there was $1.2 billion invested, including in companies like not only Zwift and TopTel, but in Calm, a wellness app for mindfulness and meditation. And in fact, responding to this concern that there's going to be this lockdown-generated tsunami of mental health conditions, the American Federal Drug Administration has actually issued a guidance document that will allow the distribution of computerized behavioral health therapies and digital health therapeutic products for psychiatric disorders that otherwise would need to go through a significant regulatory review process. And there's several companies who've taken advantage of the relaxed regulations to release psychiatric digital health products. For example, AKL Interactive has released an ADHD product. Pear Therapeutic has got a schizophrenia product. The Orexis is a depression product. Vorvidia is for alcohol overuse, and OxD1 is for opioid use disorders, another incredible scourge, particularly in North American societies. All of these companies that are succeeding because they are data-driven companies. They build data collection into multiple touch points. They are developing artificial intelligence and advanced analytics and machine learning algorithms to identify patterns of behaviors and drive consumer and clinician decision-making. But we're not just talking about these mega deals. We are talking about venture financing for not only for scale-ups, but for considerable finance opportunities for startups. Just to look across the landscape, in the major innovation centers in the United States, places like the Boulder, Denver in Colorado Innovation Corridor, the Boston, New York corridor, of course in San Francisco and San Diego being separate, all have in the order of $50 million tranches to support startups across a blended finance of public funding and early stage impact funding. Canada superclusters have got $100 million available for the same thing. And there are numerous development financing sources of finance available. And we've heard that we have South African colleagues here today on the call who are investing in this very space. So that is the big $1 billion opportunity sitting in front of us. And this is the Colleaga sandbox, bringing together the practitioners and the people who are involved with the need that is right ahead of us, and the funders, the impact investors, the sponsors, and most of all, the entrepreneurs and the participants in ventures who want to collaboratively work out how we can make a difference. So our challenge boils down to something very simple. How can we, in our group, help the greatest number of people with mental health in an effective and efficient manner? And how can we do that while still satisfying our own company goals and our personal growth aspirations? So all of us today here are social innovators. And we know how hard it is to succeed. We know that if we want to deliver value and we want to deliver the impact cake, we need the ingredients. And the ingredients are knowledge and resources and money and tools, and we need the recipes. And mostly, we need the passionate bakers who are going to put it all together. And when it doesn't work, they're going to try and try and try again until it does work. So that is what our network is about. Our network is about assembling an impact venture studio for the network, with who and what we need to build a portfolio of projects, all working towards common goals. So we are finding the impact investors, some of who are on the phone today, who may be development funders or investor syndicates or public funders to provide blended financing over multiple stages of founder growth and project growth. We're also assembling the mentors, some of who are meeting on the phone today, advisors and partners who will provide the knowledge and resources, and we're assembling that. We are finding the corporate and public sponsors who want to fund this work because they value innovation capacity building, they value the partnership opportunities and the jobs created, or they value the outcomes. And most of all, we are finding the special international and African founders with great companies and problem solvers who want to create consortiums with them and build successful ventures. But these projects never succeed in creating a collective value unless they concurrently create the value that we need for our organizations and our personal growth. So part of what we need to do in a network like this is to identify how we benefit by contributing to the collective. So if you're an impact investor, a private investor, our impact studio makes arrangements so that you can invest in the next rounds for returns. And if you're a public investor, our impact studio arrangements make sure that you can invest for the impacts that you're looking for job creation, for company growth, for tax growth, for better health systems, whatever you define as your value. If you're on a sponsor, we will make sure that you get measurable returns through exposure, through innovation capacity building for people in your companies, for partnership and acquisition opportunities, and for knowledge gathering about what is working and what isn't. And if you're a mentor or an advisor, our job is to give you exposure and eminence and the personal satisfaction that makes it worth helping others. And most of all, if you're a founder or a social innovator, we are creating the environment where the best projects are set up, resourced, and financed for traction and company growth. Lastly, what this also has to be about is local value and local understanding. We have a Canadian mental health innovation network that is starting to go, and it's about understanding what the Canadian environment is about. And similarly, the South African Mental Health Innovation Network must be about understanding and contributing and listening to what is appropriate for what is happening in South Africa, for South African patients, for South African people, and for South African entrepreneurs. It is also the job of the Impact Studio to understand how to be culturally sensitive. And when we are bringing international opportunities and ideas to the table, it is in the context of understanding how they may or may not apply in a different country or in a different region. So working out how we do this starts with 2 design thinking exercises to establish what we all think is the value that we want and bring and what our common vision is. So let's start doing that. Back to you, Katie.
Yeah, so thanks, Dan. So like Dan said, we're going to be doing some design thinking exercises now to establish what we think the common value and vision of the network is. So we're going to be going through 3 separate exercises. So 1 to define the value, 1 to workshop our vision statement, and the 3rd to establish who needs to be involved in this network to make it come to fruition. So we're going to be going through 3 different breakout rooms, or probably actually only 2 different breakout rooms. Each will last about 10 minutes and will be facilitated by either Dan or George. And essentially they'll ask you to quickly introduce yourself again, and they'll ask for your key insights on each topic that we bring up. So after about 10 minutes, we'll come back to the main room here, and we'll discuss the main takeaways that occurred in each room. So for the first exercise, Michiko actually posted a question in the community. And for the first discussion topic, we want to ask you what value you think a South African mental health network can create, and what value can it create for you personally and for your organization. So your facilitators will lead you through this conversation. They'll be taking down the main notes that they're hearing, and they'll actually be posting it directly into the community. And then once we get back, we can take a look at it and all discuss together. So we'll be opening up the breakout rooms now. If you have any questions, please ask your facilitator. You can also ask one of the innovation Sherpas that will be in your room. So with that being said, let's open up these rooms and start the discussions. I'll see you guys in a bit.
We're back. In our room, we had really a great conversation about and really heard about different perspectives of what people want. George, what happened in your room?
So we also had a vibrant discussion. I think we wished we'd had maybe 10 more minutes to continue it, but I'll pipe up with a few things and then ask others to add anything I may have missed. But there was a lot of talk around, I guess two sides of the issue. First, the impact, and then the treatment. So in terms of the treatment, there was some talk about the promise of using genetics to better prescribe medicines and so forth, so that we don't have a lot of false starting and delays. Access to healthcare was a big issue that came up, especially in the neighborhoods where the poorest of the poor may not even know these services exist, and in some cases don't feel entitled if they do know that they exist, or may not feel safe. But one interesting point that was brought up was around first responders and how they, especially with COVID exacerbating the stress that they face, that they may not be willing to engage in the workplace, that they still feel there's a stigma, and they may want to engage remotely and/or anonymously. So there was a lot of discussion around that, which we captured in the comment that we added. Serving the underserved was a theme that came up several times, making sure everybody needs this. We don't solve this problem for everybody. We haven't really solved it for anybody. So that was interesting. And there were some great points made near the end around the circle of care. So how sometimes it's not enough to treat the patient, that the patient's family or others with whom they interact may also need to be treated. And I'll end with a couple comments on areas we thought would potentially require focus. So I think the recurring themes were around anxiety, depression, PTSD, addiction, which is a huge problem over here, and breaking the cycle of violence was a real interesting and I think heartfelt topic that one of the speakers brought up. So there's especially gender-based violence. So to make sure that we give a long, hard thought about how we could contribute to that. So Dan, the rest is in the comments, but I'd offer up, maybe Lance, you did some nice summarization at the end. Did I miss anything? Or?
George, that was very well articulated. Thank you very much.
Thank you. So in our breakout room, I think we had really a good mix of. We heard from the entrepreneurs like NextJ that really the value would be they have a great solution, and what would a project in South Africa look like. What we also heard, particularly from the practitioners, is should we be focusing on prevention or wellness? Should this be broad or should we be narrow? And there were thoughts that prevention was where we would have greater impact, but it's a much more difficult problem, and in fact has less evidence that we can be successful. We also heard from the venture capital side is that really what we want is to find impact ventures that are looking at a big enough problem that we can create a really disruptive company, or find a disruptive company who can understand how to, and not just one company, but multiple companies who can understand how to disrupt and also most significantly monetize the problem. What we also heard is how do we this dilemma of we need an ecosystem, And so we heard one of our participants talk about that the ecosystem not only includes the actual treatment modalities or the prevention or the wellness programs, but also opportunities like microfinance to make sure that people can get access. Even though we need to be thinking very big, but we also need to focus our efforts, and we can't boil the ocean. And then lastly, we heard from international participants that what is really valuable about this is learning from this experiment and seeing how it's transferable to other countries and other regions. So in summary, when we think back about the questions that we asked in the beginning, that we all need to find value in this, I think the challenge in the next exercise is to say, can we construct a vision statement that we can all look at and buy into and say, yes, if we're going out to do this thing, then I can see how that collectively would be what we would all want to do, but also that it would serve my company and my personal interests. So that is the next exercise we do. Now that you've heard and we will mix the rooms up a little bit, but now that you've heard from each other about what individually we think we want to achieve, let's now go in and say, okay, how are we going to articulate what we're going to do together? Katie, back to you.
Yeah, so Michiko has posted our second exercise in here. So we have crafted 2 vision statements that in your rooms, we'd like you to kind of compare, contrast, discuss. Do you think one works a little better than the other? Why not? Or do you think neither really apply? So that's what we'll be kind of working on in these breakout rooms, is workshopping these statements. Does it align with the value that we were just talking about, as Dan mentioned? And just go over where you think the strengths are, where the weaknesses are. If we can try and make a new vision statement, that would be the ideal, but we'll see how it goes. Just your feedback is great. So with that being said, we'll open up the rooms again, and we'll meet back here. Maybe we'll give the breakout rooms a little bit more time, maybe 15, 20 minutes on this one. But we'll see how it goes. So let's open up the breakout rooms now, and I'll see you guys in a little bit.
Back in this room, we had a pretty fascinating discussion, I will say. George, or perhaps Lance, together, tell us what you heard about which vision statement was better or worse for your group.
Okay, so I think we normed pretty quickly that vision statement number 1 was the one that resonated better with the group. To sum up, there were a number of key areas when we considered, having sort of a thing we're going to do, how we're going to do it, and then a why or a purpose. And that was that there needed to be a statement in improving the mental wellness for all South Africans. But later we expanded that to South Africa and beyond. So everything we did, it's certainly centered in South Africa, but we felt that anything that we achieved in terms of innovation could have an impact outside as well, that the issues are really quite similar worldwide. There was some discussions around access and stigma, and that perhaps there should be some mention or reference to the broader access to these services. And in the discussion of access, there's some really interesting side discussions about enabling this, getting rid of the stigma by improving the circle of care, or the social circle around a person. So it's not just them. They don't necessarily want to feel stigmatized by their friends. So it's out of any movie that you've seen in the last 30 years, right? I don't want to talk to the shrink because what will they think of me? And so getting rid of that and building champions. So you have this circle of champions as opposed to circle of stigma, which I thought was really good. And in one case, there was you sort of dove a little more deeply, but almost a comparison of how someone could go into a confessional or a booth for a service they don't want to necessarily be seen and taking advantage of, and how, you know, how could we metaphorically at least deliver on-demand services where someone could just get in when they needed it and at least get started. And so I think the last thing would be on the social impact side. So we talked a little bit about entrepreneurship and social impact. We thought that extending economic benefits to all South Africans might be a bit of an overreach and worth rethinking, but emboldening, I think was I love that word, emboldening entrepreneurs to be social impact entrepreneurs and take on mental health challenges. If we could somehow work that into the mission, that might be really empowering, and it might expand the tent and bring more folks with clever ideas and access to things that might deliver, like some of whom are already here on the call, but that might deliver really innovative solutions to these challenges. That would be potentially beneficial.
Great. Let me give the feedback from our group, and then I'd like to open it up to everybody. We also sort of gravitated pretty quickly to statement one. The statement two felt a little too constrained. Some of the themes that came out for us were, to reiterate, George, what your group found is, yes, access is a key issue, and that it's that some people don't have access to the internet. So how do you create awareness that these services even exist, and how do you deal with stigma? And how do you motivate people to be more engaged in their mental health? What really resonated for me is thank you to our practitioners for bringing this to the fore, that this is about humanizing, and that we need to, and not only humanizing, but that really the economic impacts or the economic opportunities were not restricted to the entrepreneurs, but were to the people who actually are participating in improving their mental health, because naturally, if you have additional financial security or economic opportunities, that is a key part of improving mental health. And so this is about capacity building and resilience building. I think the last point I'll bring up before I open it up is what did not resonate for people in the second statement was saying this is about a suite of digital transformation ventures, but rather that this is about technology enabling any kind of service that is aligned with this mission. Let us open it up for just a couple of minutes. Would anybody like to add thoughts that they heard that we haven't mentioned so far?
Dan, yes. You could see in our group we had technologists and planners, because we were already developing minimal viable products and staging and phasing. So if you give us another hour, we'll have this entire thing planned for you.
Yeah, and Dan, the only thing that we couldn't agree with was it minimum viable or minimum lovable?
Has to be lovable for sure. Well, thank you. So Kerman made what I thought was a really, really good point. And his question was number one, even though you look at South Africa and Southern Africa and beyond Africa, even within South Africa, it's not one thing. There are a variety of different cultures, and we need to engage with a variety of different cultures. And that's why we think of a portfolio of solutions, because it's not going to be one size will fit all. There will be multiple different solutions that may work for particular communities, either because they're in particular age groups or their particular areas or their particular backgrounds. So it's not one solution we're looking for, but the trust in the platform is important. And Kerman really said, well, how are people even going to know that we exist? So to that, for that question, let me really throw this open to our South African colleagues. Who else do you think needs to be at the table? who else should we invite to join our network, because they would be a significant contributor? Curtin, may we start off with you? Who do you think we should invite to participate in this?
I think within communities, you have people that trust certain people to, you know, I think in terms of the conversation around different cultures, certain people trust only certain people to diagnose whatever problem they may have. So you look at the majority of our population, they're kind of in rural areas, semi-rural. And within those areas, there's obviously maybe doctors, there's different clinics that you can go to and seek advice if you have any health issues. I think connecting with those people, smaller businesses, smaller people that practices that focus on providing, I don't know, healthcare in general, and starting there could be a good starting point. And like you said, you guys have been to the major, I mean, you guys have already started off with the bigger healthcare providers in the country. And so you guys are collated. You said something around 10 million people you guys have access to or have data on. Or so, you know, I think it's starting off in the community, starting off in the areas where, you know, where people are hard to access, you know, because it's starting off there, putting the technology there, giving people access, you know, making people aware. Yeah, something
so
along those lines.
And that might be where we start off with or aim the solutions, but from the perspective of the large or the key individuals or the key organizations who we'd want to say, you know, you are already doing this. Cassie, you mentioned some of the large organizations. Who do you think we should reach out to and say, join the network?
There's definitely some really key people that I think would be able to add value, and I'd be happy to send those details through to you, Dan. Some who have done research in this that could, you know, this is where they could bring the data and you can, you know, really come up with plausible solutions. So I'm happy to send a couple of key names. And also, I think what's really important is, you know, again, that lived experience of someone who accesses treatment, who experiences a mental health issue, so their voice can also be heard. So I'd be happy to send a few suggestions. Thank you.
Thank you.
Hi. From my side, I would say if we could tackle the churches, because like Kerman said, most of the people trust their priests, and that's usually the person that deals with some of these issues in their communities. So I saw, especially in the townships and those rural areas, the priests and then the other informal guys that they have that are not usually in this circle are where the trust is. So if a priest knows about this and shares this with his congregation, at least the message gets out to more people on the ground.
Great idea, Tony. So is there a subgroup of the South African Council of Churches or an organization like that that has got a mental health chair?
Yes. So I know the South African Churches Association you mentioned, this is one of the topics that they do put quite a lot of interest in.
Great.
Yes.
Good point.
Jane, from your perspective, who do you think about?
I just think you've got no one from the public sector really represented here. So maybe the Department of Health, or I don't know, I'm just thinking, or social development. I don't know, there's just no one from the public sector really here represented. And maybe the other group, and I think it is what Cassie was mentioning as well, is the clinicians. So actually someone who's close to the sort of clinical treatment and diagnosis, someone in practice.
Great, good idea, yes.
And then just the last part I forgot to add is the local healers. So there is an association for that also in South Africa, similar to the medical board. And they would also be very important to get on board, just as much as the medical board would be. Because usually the people, when they have mental issues, they end up with this healers. And some of the issues are coming from there also.
No, 100%, Tony. That goes back down to the culture, you know. I think, you know, so within certain cultures, what is this, those doctors, you have these different doctors with it. I don't know, it's a different way of diagnosing illnesses. So yeah, 100% local healers, I think it's a big hit.
Thank you. Wesley?
Yeah, I think I was going to mention COGTA because COGTA is the department deals with traditional leaders, and they hold sway over a large portion of the population. Traditional leaders are huge, and that's where traditional healers also come in. But you must also remember, I've been working with mental health issues amongst local tribes as well. Mental health issues are often misdiagnosed as spiritual issues, and so I agree with social development, Department of Health. We need to get them on board, but you can't get them on board only at a conception stage. Maybe send them an invite once we have our story together. To be honest with you,
yeah.
It will be better for us to go to a government department of any kind and say, look, we'd like your opinion, we want to be a part of this. This is what we are envisaging for South Africa. These are some of the solutions that we have. This is how we plan to fund it. You don't have to worry, government. We're not going to need any of the taxpayers' money to do this. There's certain ways that you pitch things at the minister or department, whether it's a provincial or national level. Sorry, it's my alarm. It's me, my bad. But when you offer an opportunity for consultation, an opportunity to be a part of it, as we're developing it, you then avoid the process of excluding people. But at the same time, you give them information. But most of them want you to come with a solution. They don't want to have to do all the hard work because they've got so much on their plate as it is. So I think from a perspective of where we are at, there's CSRI, there's a lot of medical boards that are out there, people that with information. We can bring people on board. It shouldn't just be academics. It should be people that are in the community, that understand the community works. Local social workers that are on the ground that understand what the mental health problems are, because social workers unfortunately are not mental health practitioners, but they deal with mental health every single day. That's their biggest job, to be honest. So how we do that is all about consultation, but let's consult and bring people on board once we have a way forward. We not necessarily just when we are trying to still figure things out.
And perhaps Ross, as we start to end off the segment, which are the innovation communities that we should be bringing in?
Dan, it's quite a difficult one. I mean, thinking about it, this is a very laser focus on a very particular issue. I mean, obviously the groups that we're largely involved with, the investors, invest in a broad range of industries and a broad range of companies. So I think what would be best is, we're obviously plugged into other co-investors in the VC space in South Africa, in the private equity space. There's obviously organizations like SAVCA, but it's probably too narrow focus to get one of them involved in terms of representation. What would be best is to feed information through as things come through from investable assets perspective, which could then be disseminated very easily amongst the network that we've got, and to help to fund some of these things. But I think at this sort of stage, it would be too narrow focus for those kind of groups to get involved.
Thank you. Lance, last word to you.
Yes, Dan, sorry, I was typing away furiously. We're talking about virtual patient care and a digital and maybe sometimes a dual digital to brick and mortar service offering to disparate communities all over South Africa. Let's not forget about the Vodacoms, the MTNs, the telcos in this game. Not only to validate the assumptions of the communities that we need to serve, but also remember that somebody has to pay for this. And if you are going to pass that cost on to the end patient and down in your value chain, some of the costs can be prohibitive. I remember one of the first conversations that we had with Zane from SADC. That was one of her challenges, that there was an insurmountable barrier to overcome with huge costs.
Correct. So finding out how to get the financing to do this is going to be a key issue. Actually, what I'm going to suggest, though, is from what we've heard is perhaps mental health innovations is too narrow. What we're talking about is all kinds of innovations that have the potential to improve mental health. And that would, Ross would broaden it out considerably. And really what we're doing is we're looking at where are all kinds of innovations and how can we put on a layer, or how we can connect into what is already happening to create better mental health. That might broaden our what we do as well. So thank you, everybody. This has been a really great discussion. It's also an example of how we like to work. It is a very collaborative approach. It needs everybody to participate, to hear from each other. So as we move forward, Katie, would you mind putting the slide up of a timeline? As we move forward, firstly, we will keep this network available to everybody. These kind of networks and consortiums work if we are very focused on not only on the long-term vision, but how we move forward in the very short term. So we have a plan for the next 90 days. We understand that when we put the phone down, all of our South African colleagues will be not putting their pens down and heading off to, and I say this with a great jealousy, because I only have a picture of Table Mountain. But everybody heading off to enjoy the sun, to go on holiday, and we will not be seeing anybody for the next month or so. So let's assume that we're going to resume in the middle of January. And what we'd like to do is between January and March, spend 60 to 90 days with the group that is interested in doing this, saying, what is the scope of what we're going to want to do? What is the plan for what you're going to do? How, and what is our first phase? By the end of March, we will have a plan in place, and that plan we will then, and that plan will be budgeted. And it'll be our job to then go out and say, how are we going to fund it? All of our job in the network, and different people will have different roles. And we think that that will happen between about March and about August, maybe September, finding initial funding to get things going from August through to December. What we'd like to do is get a first pilot up and running. And the first pilot may just be an example of what it is we want to do. It'll be on a small scale, so that it's we can find the funding to do it, and then we will grow from there. It may be that there's one pilot, maybe that there are several pilots, but that's the way the Impact Studio will get going. What we'd also like to propose to everybody is that all of us think that we are going to organize what we're thinking of as the Okavango retreat, sometime between June and November, when there are vaccines ready available for us all. And let's think forward that sometime in that time, all of us are going to get together somewhere near Maun or near Chiefs Island, and we will find a place. We will invite us all, and at that point, we will celebrate the initiation of what we've done to date, and we will use that time to plan going forward. And we'll probably take a bit of time to go out on Mokoros and see the amazing wildlife that Botswana has to offer. So let's make that part of our plan. But most importantly, let's spend the next while. We will go away and we will take it on ourselves to summarize what we heard today, to develop a tighter vision statement and a set of values for all, bring it back to everybody. And for those who wish to participate in developing the next phase, we welcome you to do that. We will send invitations out. The time commitment we anticipate will be one meeting in January, probably a longer meeting or two meetings in February, and a third meeting in March, at which point we will have coalesced what it is we want to do in the first phase with a budget that we can then go out and see how we can get funded. So questions or thoughts about that plan? Great, it's all clear. If you do have any thoughts or questions, please reach out to our innovation Sherpas. You can come through the circle where we set up, or email us. We will continue to post additional information into the circle as we move along. So let me wrap up, because another thing we really believe in is finishing on time. And let me just say to everybody who has participated today, thank you. Thank you, thank you. The consortiums like these are never easy to set up. Networks like these are never easy to set up. What it takes is the commitment of people like us. It takes people like us who have many diverse strengths, who have complementary interests, who have passion to make change happen, but who also just show up. So thank you for doing that. Thank you for your inputs today. And for all of those who are heading out on holidays, have a great holiday, stay safe, be well, and be kind. And let's hope that in 2021, we'll be celebrating together, having launched our network. Thank you, everybody.
Thanks, guys.
Thank you.